State of Nigeria's healthcare system since the country's independence 56 years ago appears similar to the past and present situation in the country. Health experts agree that an evolution has indeed taken place in the health sector, from mission-owned health facilities to the establishment of thousands of public and private hospitals. There have been some level of relative improvement in Nigeria's health indices, and this includes the reduction in maternal mortality ratio from 800 per 100,000 live births between 1999 and 2003 to 576 per 100,000 live births in 2013. According to the Nigeria Demographic and Health Survey, under 5 mortality rates for the same period also dropped from 201 to 128 per 1,000 live births. But the slow pace of development remains glaring, with the health system still struggling to deliver efficient and effective healthcare to the people.
We describe the health system currently as a system that is on the tip. And a true pyramid on tip is not stable. So we want to put it on the base. Let 70% of Nigerians go to primary care center, about 20 to 25 go to secondary, and 5% or at most 10 come to LUTH and the other tertiary centers. And then we'll be able to take care of them effectively.
Give the hospitals good equipment so that they can give people better treatment and take care of the doctors and nurses.
Poor funding for health, which has been hovering around 6 to 7% of every budget, remains one of the major hurdles that the health sector has to scale. It's been in the way of universal health coverage for Nigerians and effective primary healthcare services, among others.
From mid-2017 towards the end of 2017, Nigerians will begin to see the dividends of these efforts.
Infectious disease control is yet another thorny issue. Although it's on record that Nigeria eradicated smallpox in the 1970s and contained Ebola in 2014, Lassa fever, which was first described in Nigeria in 1969, is still claiming lives in the country. Also, the 2-year polio-free status of the country has been reversed with the recent cases of poliovirus in Borno State.
With polio, there's actually no other infectious disease in Nigeria for which we have built a better capacity to respond to. What happened in this recent case would be clear to every Nigerian. We have real security challenges in the northeast. There's very poor accessibility to many parts of the northeast. New pathogens emerging every day. So it's critical that Nigeria has the capacity to identify and to respond to these challenges that will keep coming up.
There have been challenges also with Nigeria's pharmaceutical industry. Drug distribution is chaotic. The National Food and Drug Administration and Control, NAFDAC, is still battling with fake and substandard products, while only a few of the over 300 pharmaceutical companies in Nigeria are recognized by the World Health Organization.
4 manufacturing facilities were pre-qualified to WHO status, meaning that the products pre-qualified in those manufacturing outfits can compete favorably in the international market.
We're talking of how do we motivate the industry to produce 70% of our requirement. 30% possibly, yes, we can import. But unfortunately, it's the other way around now. We need the government to really implement.
Nigeria's health system has come a long way, but still has a longer way to go to compare with other developed systems around the world. Healthcare industry watchers believe that repositioning Nigeria's healthcare delivery system to meet the health and development needs of the people requires political will and commitment by all levels of government. Yomi Otaigbe reporting for Channels Television News.